Well, we are going to get started. Thank you all for joining us today. My name is Laura Evans. I'm the Director of National and State Policy with Vibrant Emotional Health, and I will be your Crisis Jam host for the next 60 minutes or so. We've got a really great featured presentation today from Madhuri Jha. She's the Director of the Kennedy-Satcher Center for Mental Health Equity. And she's going to talk about embedding equity into 988. So looking forward to that presentation. But before we get there, we're going to move forward and just give updates that we always do on participation in the JAM. So we are up to 71 national organizations. We've got multiple countries joining us. Typically, we have a map here where we show the state agencies that are involved. I'm very glad to see we have at least one state Medicaid office joining us. Always very important. Please feel free to let your colleagues know about the JAM. This is a great learning opportunity. You can join us on Zoom Live, or as you can see here, it's also available for YouTube if you are unable to join for the live session. Right now, we have 403 YouTube views for the launch of 988, the July 13th Crisis Jam that had the Assistant Secretary and other folks. So very excited. We're over 3,000 strong, but we need more folks if we're going to make a difference in this crisis continuum. So please feel free to share this information with your colleagues. Let's go to the next slide. All right, so did the Crisis Jam disappear from your calendar? It did from mine, but there's an easy fix. You can download a new Outlook series and you are able to just import that right into your calendar so that you don't miss a jam. And feel free to reach out to Karen Jones or Rin if you have any questions, but let's get that back up on your calendars. All right, so the crisis talk isn't just the jam, but there's also a website, talk.crisisnow.com, where you can find out more information. You can have the Zoom link to join us directly. You can sign up for the newsletters. You can view information from past jams, see who's coming up currently. You'll see here we have broken it out by segment, so you can click the YouTube link. You can see the crisis cards, the trivia hot seats, the feature presentations, the quotes, all of the segments that you know and love are available on talk.crisisnow.com. All right, so just a bit of crisis news. So this is a recent survey that came out from NAMI. And if there's any NAMI folks on here that want to talk through it a little bit, just let me know. But it says, and I haven't been able to read through the full report that Karen just dropped in the chat, but that according to their survey data, 44% of individuals are aware. So that's either very familiar, somewhat familiar, of 988 as an emergency number. That is about a 22% jump from where they were in May 2020. So we see awareness really increase after July 2022 when the number was formally launched. I think this is an encouraging number, 44%, particularly since there hasn't been a widespread nationwide campaign, but certainly we want to see that number get up there so that everyone can reach out for help and are aware of the number if they or their loved ones need support. Moving on. Speaking of a national campaign, while that doesn't quite exist yet, a lot of folks are being really creative in how they promote 988. So this is just a billboard that was shared by Dr. Joan Galise, and I apologize if I have mispronounced your last name there, but outlining the ways that folks can reach 988 via call or text 24/7 for that emotional support, making sure that we are getting that awareness higher. And I know this is one billboard, but there have also been things on trucks and other creative things. So if you see that, send it to us. Happy to promote that. So our featured quote for this week comes from Lisa Morgan with autismcrisissupport.com, and she will be on our roundtable following the featured presentation today. Her quote is, "The autism spectrum isn't linear, but circular, with strengths and challenges that change throughout the day." And I think this is a really great reminder for us that we're all human And so it is circular, and things ebb and flow. And so it's really important to keep that in mind, because we're working with other people. And so this will allow us to better serve them. So with that, I'm going to move it to our featured presentation, and I'm going to turn it over to Wendy Farmer to introduce our speaker.
Thank you so much, Laura. It's a real pleasure to be here today to introduce Madhuri Jha. She is the director of the Kennedy-Satcher Center for Mental Health Equity at the Morehouse School of Medicine here in Atlanta, Georgia. We have had so much joy working with Madhuri and her staff on this amazing program. And she is not only dedicated to equity in all of her work, but has really taken a special interest in equity in 988. She's an epidemiologist by training, also a clinical social worker, and has done work on ACT teams, and really is dedicated to ensuring that individuals in crisis receive the best care possible. And we at Beacon Health Options have really had the pleasure of working with her and her team on this wonderful project. So without further ado, we'll give you Madhuri. Thank you.
Thank you so much, Wendy. It's a pleasure to be here again. I saw some of you, I think, on this call a few weeks ago, where we kind of gave you a brief snapshot on the data corner that we had, but I'll reintroduce myself. My name is Madhuri Jha. I'm the director of the Kennedy-Satcher Center for Mental Health Equity here at Morehouse School of Medicine. Kennedy-Satcher Center, for those who don't know, was founded in 2015 by Patrick Kennedy, former Congressman of Rhode Island, of course, longtime mental health advocate, and Dr. David Satcher, 16th Surgeon General of the United States. And we really work towards ensuring that equitable access to behavioral health care and opportunities to achieve optimal health outcomes are included in overall efforts that we invest in the United States to advance health equity in general for all. Next slide. So this is no new news to everybody. What is 988? Of course, it's our psych emergency line. And I put this slide here too, because I'm going to talk to you about some of the work that we did ahead of the launch of 988 to kind of give you a shadow into what we're going to be doing now that 988 has gone live. Next slide. So these are some statistics that I try to use as a framing context to make sure that we're understanding equity and crisis response. We know that communities characterized by both racial and ethnic diversity and poverty see lower rates of long-term retention and treatment. We also know that stigma and cultural beliefs about psychiatric issues can be barriers to treatment for many communities that have been historically marginalized by our system. We also know that there's been historic misdiagnosis of brown and Black children and adults. You see an increase in misdiagnosis of ADHD, schizophrenia, which we know are also diagnoses strongly correlated with crisis. We also know that individuals with limited English proficiency have greater difficulty accessing care and preventive services. And to address rurality, we know that more than 120 hospitals in rural areas have been closed in the last decade, which leads me to use this one statistic that I always highlight for folks, is that more than 75% of all US counties are mental health shortage areas, which is a huge crisis in itself within our system, right? So I want you all to think about these statistics as we go through how we're addressing equity with 988. Next slide. So what we did was a comprehensive literature review of over 300 articles, and we complemented that with an IRB-approved leadership experience survey, which was administered by word of mouth and responded to anonymously by dozens and dozens of leaders in the field. Many of you on this call were actually participants in that survey. We're very grateful to you. As you can see, we tried to be very inclusive of the type of title a person carried that we wanted to respond to us, and answering how equitable was the crisis response system prior to the launch of 988. Next slide. And what we learned is that there are specific groups that have been historically invisible within our system. And this was an evidence-based call out to be able to say, can we do our best to reach these communities? People who identify as LGBTQIA+, we know BIPOC communities have been historically invisible, rural communities, immigrants, refugees, and non-English speaking people, people living with disabilities, older adults, people experiencing homelessness or housing instability, formerly incarcerated or justice-involved populations, survivors of trauma, which includes veterans, and neurodiverse people who will have a specific lens when we talk about our presentation today a little bit later. The overarching theme here to also know is that this is, of course, inclusive of youth, youth being the folks who access things like a crisis text line the most. So that is something to know, is that an underlying risk factor is also age. Next slide. So we learned a lot through that survey. And what was really rich in that was not only a short survey that was answered quantitatively, we also were able to receive a lot of just written responses from the people who took it. 100% of the respondents advocated for cultural context training. 93% said that de-escalation and mental health first aid training need to be mandatory at all levels of crisis response, including dispatchers and anybody who might make up a mobile crisis team. And 89% advocating for training to assess for primary language of a caller. This is a big one, to ensure that language access is met appropriately. We know a lot of folks who don't speak English may actually have English proficiency when they feel calm and they feel stable, but while experiencing crisis might more easily communicate when they go back to their native language. I've been present when someone has been translated incorrectly. They were asked if they were hearing voices. They heard that person's voice and they said, yes, I hear yours. And that resulted in an appropriate 72-hour hold, right? So we want to make sure that people are being able to access the service in the language that they speak. Next slide. But the biggest one here to take home is that 92% of our respondents said that the current psych emergency response system was not equitable, right? This is prior to 988, which is a huge foundational statistic to take home to say, what can we do now, especially in this year one of 988 being live? And 7.4 said they were unsure, but we didn't have a single respondent that actually said that they believed that the system was equitable. Next slide. So at the Satcher Health Leadership Institute, what we always say is that if there is no data, there's no problem. And if we can make the moral argument for the reason for equity in a system like 988, we have to be able to back that up with evidence. So this is a piece of this work that I think is truly important for us to understand what this means. We know that data collection has historically had a lot of barriers to understanding intersection of equity and behavioral health. We know that we need to do a better job of disaggregating robust data, making sure that we're very inclusively capturing who's accessing crisis response. And we also know that we have to be able to understand the disaggregation of data as it relates to the full burden of mental health and behavioral health inequity, right? So if we have a way to capture how regions, states, whole parts of the country are doing, we'd have a better sense of knowing what kind of resources are available. Next slide. This is just one of the quotes that we received from one of the survey respondents. You can see that a lot of folks were really clear in saying that there are many, many layers to the inequities in the system that we have as it relates to access, the infrastructure, staffing is a big one. But more importantly, also referral to providers after someone calls a crisis line. And, I want you all to keep that in mind too, that this is going to be a long-term process that we hope is, again, something that can start here. Next slide. So I'll just get into briefly overlaying the recommendations that we were able to determine about how 988 can have equity embedded into it continuously. As I said previously, we want to uplift groups who are historically invisible. We want to have law enforcement be as needed as much as possible. We know with 75% being clinician shortage sites, we will have to continue to rely on law enforcement at a level. All of our respondents pretty unanimously said that it should only be as needed. We know we want to have trained mental health professionals available as much as possible, and also include that peer recovery specialists are essential to really meeting someone where they are when they're in crisis. We also want to leverage local clinics as the experts in crisis response for 988 calls, but this also comes with a caveat, which I'll explain a little bit later, that we want to also make sure that there's a cultural response, that we are giving folks a safe place to go if they have certain intersectional identities that affect their care. We want to implement comprehensive trainings to have more equitable response. I'll talk through a little bit about what some of those are. And then lastly, we want to give the caller a choice to use geolocation services. An opt-in option is what kind of comprehensively and coherently the consensus was during our look at this, is that allowing someone to opt into geolocation is the best way to be able to reach them. Next slide. So again, as I said, as needed, right? And we know that this comes from unintentional harm. Law enforcement is not skilled in this. They're not trained. It's not what they're asked to do. And yet we have this issue where law enforcement will continue to be relied on. So if as much as possible, you work within your communities is to see what resources are there and what's needed and advocate for those things to become more effective when responding to someone in crisis. Next slide. This was an interesting part of this is that 85% of our respondents also deemed a peer recovery specialist as essential part of a team, in addition to mental health professional, but other titles that we saw as available could be helpful: a psych nurse, a licensed prescriber for consultation, a medical translator for communities where English may not be a dominant language, and as well employing the help from cultural community leaders to be a bridge for certain communities as well that have historically mistrusted the healthcare system. And we did a highlight on the telehealth licensing compacts that majority of states in the US have signed through COVID, right? And how they can be something that you can utilize to help mediate, when someone accesses crisis services and perhaps has to wait for an appointment to see somebody long-term, but also thinking about incentives to recruit workers to the rural landscape where we know that there's a shortage, and how can we tackle that? Next slide. And again, also, in addition to leveraging local expertise, we want to pay attention to specific communities that we know might be experiencing poor crisis response historically. That includes tribal communities. A biggie is people experiencing homelessness. Often that experience is very underreported because a lot of people aren't actually flagged by our system. But we also know that a lot of 911 calls are for people who might be in crisis, who might be experiencing homelessness, and they're more often met with incarceration and inappropriate response. 63% of our respondents also said that we could leverage allyship with LGBTQIA+ organizations and other homeless housing agencies, as well as other culturally appropriate agencies, as additional spaces to host 988 crisis teams. If those centers already have behavioral health services embedded in them, they might be a cultural expert in reaching certain communities. Next slide. And obviously the issue of geolocation has been a huge debate throughout this whole process. There was pretty widespread consensus that an opt-in option is the most caller empowered way to promote safety. We know that some elements of geolocation cause further harm for certain communities in certain parts of the states, certain states, for example, where there's a legislative reprimand if you disclose certain part of your identity. But we also know that certain communities, for example, undocumented folks, may benefit from knowing where there is a safe clinic for them to be able to access services and not be met with some kind of punitive response. So we highly recommend advocating and continuing to advocate for an opt-in or opt-out option for the caller to decide for themselves. Next slide. So to think about how we're going to imagine this moving forward, you all will actually be privy to the next phase of this will be released next week. And so quarterly, we're going to be looking at what's publicly available. There's huge evidence in how public health communications can advance the reach of something like 988, since it's a transition and it's a behavior change. And we want to know what states are doing. We want to be able to hold some states accountable for that. So we are examining everything that's publicly available based on the recommendations that SAMHSA has made to states in terms of effective administration. That includes the creation of a designated 988 website localized to a state, publicly available implementation plan, context around who that advisory board or advisory council is, and how representative are they possibly with the equity populations that we've prioritized. And lastly, are they creating marketing materials that are specifically tailored to not only the state and territory, but also certain populations we know, again, we've been highlighting as historically invisible. So you will start to see that come out from our center. Actually, beginning next week, we have the first scan of the first 3 months. I can tell you firsthand, some states are knocking it out of the park already. And some states are actually not, right? And so you all have a role here in being able to ensure that we can have this, widespread reach and access of 988, but also ensure we're rectifying some of the historic challenges we've had with certain communities not being able to get access to care. So I'll stop there and I'll allow my panelists to come in and, introduce themselves and respond to the work. They've both been very involved in the work that we're doing as well. And so I'm looking forward to hearing what they have to say.
Great. Thank you so much for that great featured presentation. At this time, I'm going to bring in Lisa Morgan, who's a self-advocate and consultant in crisis support and suicide prevention for autistic people, to this discussion, and also Dr. Linda Henderson-Smith, who's the National Director of Children's and Crisis Programs with Beacon Health Options. So I'll turn it over to Lisa.
Thank you, Laura. First, research has shown suicide to be a leading cause of death for autistic people across the lifespan. The risk factors for the general population pertain to autistic people, along with several unique risk factors found through research studies. Some of the risk factors are masking or camouflaging, being autistic, co-occurring mental health conditions, social communication, the number of unmet support needs, a diagnosis of autism later in life, being an autistic female, and autism burnout. And I'll explain autism burnout because it's not really widely known. Autism burnout is a syndrome of constant exhaustion, loss of skills, and reduced tolerance to stimuli that can last up to 3 months or more. It's due to the demands of life chronically outweighing the ability to cope and lack of support. So if an autistic person calls or texts into 988 for help during a crisis and is met with unintentional stigma or invalidation, which is common when people do not understand autism, they are at risk for autism burnout. And a way to help reduce unique risk factors of suicide for autistic people is cultural competence and humility while supporting them. Reducing unintentional harm due to miscommunication and not understanding how autistic people think and experience the world is the overall goal. Many autistic people experience unintentional harm when calling or texting into crisis lines because autistic people communicate differently and even experience distress and crises differently than non-autistic people. 988 is still a crisis call or text line with the same challenges for autistic people that the crisis centers have always had. I'm hopeful 988 will have an internal number for autistic people to use to get autism-specific help and support. And there are autism-specific resources available to help professionals communicate with autistic people in crisis. The Crisis Supports for Autism Community Toolkit, developed by the Autism and Suicide Committee of the American Association of Suicidology, is being used in crisis centers across the nation to both identify and communicate with autistic people in crisis. And the toolkit is being used by other professionals and even family and friends. I believe 988 needs to have autism-specific training with the toolkit to reduce unintentional harm caused by well-meaning crisis center workers who are there to support autistic people. There's also a toolkit about considerations to take when using warning signs of the general public to assess autistic people for suicidality. So understanding that autism is a different way of being with its own strengths and challenges can help with communicating and supporting autistic people. And it's not really widely known, but some of the strengths of autistic people that can be used to help during a crisis are being rule-based or adherence to routines. These strengths can help when the use of a safety plan is crucial to staying safe. Honesty is a strength useful when assessing for suicidal thoughts or intent. The need for fairness can be helpful in reframing a suicidal crisis. Being detail-oriented can be useful in knowing when to get support or implement a safety plan. Creativity and problem solving can be useful for every aspect of staying safe in a suicidal crisis. So if first responders, crisis center workers, and other professionals can culturally understand the way autistic people communicate, think, and experience the world, especially when in crisis, the unintentional harm to autistic people when they reach out for support can be reduced or hopefully a thing of the past. Thank you.
Thank you, Lisa. Really appreciate that information. And thank you, Wendy, for putting in the links. So at this point, I'm going to bring in Dr. Henderson-Smith to get her reactions to the presentation.
Thank you, Laura, and thank you, Lisa. I want to really build on what Lisa talked about. So in working with Morehouse School of Medicine, and as part of the work, there was a leadership summit where Lisa actually came and provided the same level of information, but also told her story. And as such, right, as Beacon Health Options really, through our crisis line work, decided that it was important for us to embed equity into what we do. And so one of the things that I think is really important that was done was taking the toolkit that Lisa just talked about and really embedding it into the work that we do. So not only have we begun training all of our crisis workers on that toolkit, we also have embedded it in our supervision, in our quality management, and also in our peer support. So one thing that we've done is really engaged in crisis rounds where we have clinical leadership that actually listens to calls and then takes it into a peer-to-peer situation where they are looking at their risk ratings, their engagement, and really aligning it with the evidence-based practice based on different populations that are served. And it has really resulted in being able for our crisis workers to engage differently, to communicate differently, and to actually work better with populations that has allowed for better assessment and better outcomes overall. Right? Lisa's quote around the autism spectrum being circular, not linear, is one of the ways that we've really kind of engaged our staff to really understand how to work better with this population. The other thing that I think is just important to recognize is that embedding equity is truly an ongoing, continuous quality improvement process. One of the things that Madhuri really indicated was that, this is ongoing. This is not something that's just a fly by night. And so I think it's important for us to really think about what it means in terms of hiring, ensuring that people who are answering the calls, going to people's homes or in the community and working at the places like somewhere to go, really truly look like and come from the communities from where the people that are accessing 988 really can feel as if they belong and that they can see themselves. I think the second part is to really recognize that it's not just about the hiring and the training, but also supporting the staff and making sure that they have the tools, the resources, and the supports from the organizations that we're working within to really get what they need in terms of support. So oftentimes we don't recognize that they too have their cultural identities and may potentially be from from groups that are historically invisible. And so we need to ensure that we're supporting them in their learning, in their growth, and in their wellness, as this work is hard. So I know that there are some questions, and so I'm excited to answer those, Ms. Laura, if we can.
Yes. Well, thank you for your commentary, Dr. Henderson-Smith. And I also want to note, Vibrant, as the administrator of the Lifeline, we were very fortunate to have Lisa come speak to our crisis centers and the Lifeline network around how to better serve individuals who are neurodiverse. But as you just highlighted, it is not a one training and then you're done. So I'm hoping that any of our speakers could speak to how centers can really move beyond just maybe an individual training and really embed it into their practices. And certainly there's a question in the chat if you all are available to help entities think through this. So I'll put that for anyone who wants to take a stab at it.
So, I can start and then Madhuri, maybe you can join. I think the part about embedding that's super important is realizing, like you said, the training alone doesn't really do anything, right? All the research says that it takes training and ongoing coaching. And so really ensuring that it's not just about training, but that the information from the training is built into ongoing supervision, into ongoing quality management, right? And then is repeated, because people don't just kind of hear things one time and remember it, right? I've always said 6 times, 6 different ways is kind of how people can get that. So one example is, one of the things that we do is we send out a tip of the day every day to our staff that has different tools and resources that really can help, because some people learn by hearing, some people learn by reading, some people learn by doing. And so we try to make sure that it's embedded ongoing in the communication and support that we provide.
The only thing I'd add to that was just obviously a good description of best practices, is that we want to make sure that you all are advocating for this to be through every level of your workforce at your entity as well. There's a huge power when your leadership is super invested in equity being embedded into your work. And what that looks like. And for those of you who are leaders at your organization, it starts with you, right? And how you can model that being a priority in your organization, and not really just leaving it to be something that you do for compliance reasons, for example, or a mandatory training that, you know, direct frontline service workers have to do. It has to be something that is seen as an investment from leadership. And I really commend some orgs that have really thought that through pretty exceptionally. And that also includes in hiring practices across the board, right? That you want to be able to see that the communities you serve are best represented in all facets of your organization, because I think that also creates a bridge with a lot of the populations that have been appropriate to mistrust what crisis response could look like for them, and have maybe seen more incarceration or inappropriate psych emergency room visit than an opportunity to de-escalate on the phone, or be able to just be met with someone in person and feel like they're being safely responded to.
Lisa, did you want to add anything to that?
Yeah, I mean, I think they're both have covered, you know, a lot of it with, I think with the buy-in, like, because if people don't take it as, yeah, I checked off the box and I did this and I did that, and instead looked at it as a kind of a change of a mindset, I think that, you know, it would move forward faster and be accepted more. I know for autistic people, it's a cultural thing where if people are accepted for who they are as a person, but there's so much stigma out there and myths and just different, you know, biases and different thoughts about autistic people, you know, for example, that it's a change of mindset.
Yeah, well, thank you. Thank you all for this really great discussion and presentation. I'll also end with, before we move to the next segment, just a comment in the chat from Jean that says peer supports are vital members of behavioral health teams. Ensuring pay equity is addressed while budgeting. I think that gets to the point that you all have mentioned around ensuring that that the workforce reflects who's being served. And that we are, again, paying them a living wage so that they can engage in this work. So thank you all for this discussion. Dr. Henderson-Smith put an email in the chat if anyone wants to reach out, but we're going to keep moving. Thank you.
Thank you.
All right, and so we are here for the t-shirts that are available, the jam session t-shirts. There are 5 options, 4 logo and color options for a total of 20 different shirts that could be available to you. And I hear that we are coming forth with long sleeve options, so feel free to get your shirt at the link that was just dropped in the chat. And another way to get a shirt for free is to participate in the hot seat. So let's move forward. And please feel free to email Karen if you do want to volunteer for the hot seat. This week, we are very fortunate to have Greg DeSherry join us in the hot seat. So he will be receiving his t-shirt for free, no matter if he gets this right. So again, it's available no matter how you do in the hot seat. But Greg, are you ready?
Oh yes, this looks tough, but I'm gonna give it a try. Thank you for having me today.
Yeah, no worries. I'll just do a little intro here where our roundtable panelist, Lisa Morgan, in her TEDx talk described typical actions of kindness and supporting gestures that might be unnerving to a person on the autism spectrum, and even a violation of personal space can be very scary. So the question is, which of the following options were helpful when she described what happened when her husband died and the police were present? So feel free to talk this through or call on folks from the audience.
Okay. Well, I'm going to say person asking, I'm talking to the semi-final answer, person asking what was needed before taking any action, I think is usually a good idea. Victim advocating, encouraging interaction with therapy dog, police officer consoling hand. Oh no, that probably wouldn't be good. Neighbor inviting a shared meal. I'm going to have to go with A on this one.
Well, we can if you want. No cost to you. We can poll the audience. I don't know if the poll is up and we're seeing the results. But if you're ready to lock in A, we can do so.
I am ready to lock in number A.
Okay, looks like most folks agree with you. So let's see what the actual answer is. Yes, A. Yes. In lieu of reading this quote from Lisa, perhaps I can invite Lisa to come back on camera to talk through why it's important to ask.
Well, the reason it's important to ask is because autistic people, you know, it's that whole thing about experiencing the world differently and thinking differently. And so asking for us to make sure what they need and how to support them just alleviates unintentional harm.
Perfect.
And I think that's just a great philosophy too with anyone. I mean, obviously for someone with autism, but just anyone, like, hey, what is it that you need? How can we help you? How can we be of assistance?
Yes, I agree.
Yeah. Thank you, Greg. You get your t-shirt. Thank you, Lisa, for this reminder. Again, it seems so basic, apply to every person, but oftentimes we forget that we need to ask the person what they want. And I think that applies across the equity spectrum of ensuring that we're allowing communities to tell us what they need instead of us telling them what they need. So let's keep going. Lots of good information this week. And I'm going to turn it over to, thank you, Taja, turn it over to Stephanie Hepburn to talk about a recent article.
Thanks, Laura. So I'd like to welcome Craig Miller. He is an author and suicide prevention advocate. Welcome, Craig. If you're on the call, if you could share, are you there?
Yep.
It's great to see you.
You too.
So if you could share a little bit, in our interview, you shared two sides of a coin, which is you're grateful for 988, but also that it needs to work. Could you share what that means?
Yeah, I mean, first off, and I speak a lot about this, that just being grateful that from the other side of it, right? The two sides of the coin, from the other side where I'm someone who needs help more often than not. Knowing that we're being heard, knowing that there's really at a federal level that there's actual change moving forward, and that we have that support, I think is something that is huge to me. It's critical. But I think what's most important more than anything is when we do start marketing and you do have people calling the number, that it has to go positive for people as much as possible. And I think we know that, but I just want to speak to it from the side of an attempt survivor and someone who struggles with suicidality often, and what it actually takes to reach out for help. I mean, that's something I think we can't ever forget or minimize in any way, like overcoming what it takes to actually reach out and talk to somebody. For me, my first introduction to the mental health system was not a positive one, and it set me back a long time. So if we have people who are finally seeing like, oh, okay, they're doing it, they implemented a new number nationwide, they're going to help me, they can do this, and then you get the courage to make that call and do that, and you have a poor experience like was mentioned in some of the earlier presentations. I mean, that could be it for a lot of people, that they might turn their nose away at it or turn their back to it, and they might not give it a chance again. So I think that is critical for that first introduction. It's so important. I actually have a whole piece of my talks that I have a video. I'll post the link that I made years ago.
Lovely.
About my first day, like I think it's called The Biggest Day of My Life. And it's about that. It's about reaching out for the first time and not having a positive experience and the impact it could have. So I think that's a constant reminder. And I know we know this, and I don't know, I don't really know how to do that, right? How do you fill in that gap? And then when it comes time to market and get people to really see this, I hope there's like a PR expert that kind of looks at that. I saw on one of the slides earlier, it mentioned marketing, and I think that's absolutely critical. Do we go about it transparently and say, hey, there's struggles, this is everything from federal government down to grassroots efforts, there's a whole lot happening, there's a lot of people who are just jumping in to volunteer to help? Do you be transparent with that messaging and say, we're still working through a lot of things and this is how it's going to work? Or I don't know how that works, but I'm sure there's a strategy that's best for everyone. I can tell you personally, transparency is something I really appreciate. Knowing that people are working on something and it's not very easy, but the challenges are identified and solutions are being put in place. That's comforting to me to know it's being worked on, especially if I am involved with it in some way and it doesn't go well. You tend to be a lot more forgiving.
Thank you so much, Craig. I'm going to finish with one of your quotes that I thought was really powerful. This isn't just a mental health crisis happening, but also a mental health movement. So thank you, Craig, and I'll pass it back to you, Laura.
Thank you, Craig. Thank you, Stephanie. I highly encourage everyone to read this article. And I think, Craig, in your discussion with Stephanie, kind of mentioned that this work isn't easy, and it's not. I just came back from Crisis Con last week, and we'll talk about that later in the jam, but the work that the crisis centers do and the crisis counselors do, it's not easy, and they do it because they do care. And so we're just really fortunate that we're able to leverage this moment to ensure that everyone has a really positive experience to the extent that they can and we can with 988. And I'm sure that our SAMHSA partners will speak a little to what's upcoming around communications, but just really encourage everyone to go to talk.crisisnow to read this article. Thank you. So moving along, last week there was a discussion from a detective, and I apologize because I did not make it, but there was a discussion around ride-alongs, and I think that also came up from other centers around how to build partnerships with local PSAP so that they know that the 988 centers are there, and we are making sure that people are getting the right intervention at the right time. So he shared these tips, or the detective shared some tips around arranging a police ride-along. They're here on the screen. Feel free to take a screenshot, or of course you can always go to talk.crisisnow.com to view this at a later date to make sure that you are following these tips if you're interested in arranging a ride-along and building additional relationships. So let's keep going. And now I'm going to turn it over to Dr. Palmieri from SAMHSA to give us an update.
Thanks, Laura. And thanks, Craig, for sharing your story, reminding us how challenging it is to ask for help and how important it is that we get this right as we're implementing 988, expanding access and improving our system. So a couple of quick updates from our part, mostly related to funding opportunities that have been afforded through the Bipartisan Safer Communities Act. I think you're mostly aware of these, but just wanted to flag two of them. One is the 988 Tribal Response Funding Opportunity that has a new deadline of November 8th. I can throw the link in the chat, but just wanted to make sure that there was broad awareness of this opportunity for tribal nations, tribal organizations to apply for funding to strengthen 988 response coordination of crisis services for tribal nations and tribal citizens. And then recently announced a supplemental funding opportunity for states and territories that will be used to enhance 988 response and workforce expansion, including efforts to improve 988 911 coordination, infrastructure, communications, marketing, and evaluation activities. So a little bit of a broader array of workforce opportunities through the supplemental state and territory grant. And we're very aware that these are on very tight timelines and wish there were some ability for them not to be, but unfortunately have also been working quickly and under our own kind of timelines to try to get funding as required by the legislation out by the end of the calendar year. So that's kind of our time, that has been our time constraint. I don't think, Laura, that Richard McKeon is on the call, so I think I'm just going to turn it back to you.
Perfect. Thank you so much, Dr. Palmieri, for all that you and the 988 coordinating office and SAMHSA is doing to ensure that we are embedding equity. So I put in the link for the grant announcement for the tribal nations, but please, Dr. Palmieri, if that is not the most recent link, to drop it in there. All right, let's keep going.
Thanks.
All right, so our friends at NASHBID, the National Association of State Mental Health Program Directors, their leadership is at the International Initiative for Mental Health Leadership this week. So I'll just pause to see if there are other folks from NASHBID. I don't know if AJ or Christy want to give us a quick update, but otherwise happy to keep moving. All right, so let's keep going and we'll get an update from them next week. At this point, I'd like to turn it over to Karis Myrick, who's going to give us her perspective through the lived lens. This is a newer segment for the Crisis Jam, that to ensure that we are hearing directly from individuals who have living experience and how that can be embedded throughout those parts of the continuum: crisis centers, mobile teams, receiving and stabilization facilities. So I'm going to stop and turn it over to Karis. Thank you, Karis.
Thank you. You guys should have asked me for a picture. That picture is so flippin' old. I'm looking at it and laughing. And I'm ready for Halloween. So if you're wondering why I have this headband on and a Halloween shirt, that's why. So I thought the easiest thing for me to do, because today's been already a long day, even though I'm in LA and it's only 9:47, and I have a raging headache. So I'm going to try to make this as easy on me as possible. And I'm just going to read something to you and then maybe share a little bit after I read it. And it's called The Red Shoes of a Black Unicorn. So cherry red 1461 Doc Martin Oxfords. I wanted those shoes forever, and I saved up my pocket change until I could finally afford them. Bought new outfits to match them and wore them nearly every day, and I survived a life-altering, horrific experience in them. My first encounter with the mental health system during a crisis occurred when I was in my late 30s in Los Angeles. The voices only I could hear were relentless, calling me derogatory names, telling me I was stupid, worthless, useless, and ugly. Whenever this happens, I run inside myself, hiding the very essence of who I am, inward, in a deep and dark place. Outwardly, I am withdrawn, silent, and segregated from the world around me, never leaving my home, never eating, missing work without calling in, and giving up on life. And perhaps the voices are right. In times like these, my mom would recount the day I was born as proof that I belong in this earth and was loved and had a grand purpose for being here. But could I trust her? Could I trust anyone? The voices are such powerful liars that they easily cross over the invisible line between lies and the truth. And I cannot help but to believe them. And I shriveled up in a ball in the back of my closet, enveloped in the dark, throwing clothes over myself in hopes of drowning out the incessant chatter cursing at me. This is what it's like sometimes, even when in treatment, to live with a diagnosis of schizophrenia. And that terrible night, the voices wouldn't relent. Terrified and too embarrassed to call my mom, I reached out to my doctor. And surely he's a neutral source, and I had to trust that he could get me out of this untenable situation. So I was in trouble and needed help, and my doctor quickly responded, saying that he had to call help to come to me. So at that time, of course, it wasn't 988, but let's just say he called, our version of 988, right? And unfortunately, 911 was dispatched with a co-responder model. So when they showed up, I think I might have said something to suggest that the only way to end the onslaught of the noise and distress was to wake up dead, that I had had it up to here, as we say in the Black community. I just had it up to here, kind of as we say. And the mobile team interpreted my ramblings to mean that I was suicidal and deemed a danger to myself. So I was transported to the psychiatric hospital that they called County. And upon arrival, I was escorted to the ward, which they kept calling the milieu. I don't know why they thought I should speak French at that time, but that's what they called it. And really, it was a psych ward. And a nurse, or what I thought to be a nurse, asked to take my temperature, and I responded, no, thank you. I thought if this so-called nurse didn't provide any services like taking my temperature, then they couldn't bill my insurance, nor would they make me stay. Also, I had no idea what taking my temperature had to do with why I was there. No one bothered to explain it to me, and no one asked why I declined. And the next thing I knew after I had said no to the temperature was code. And a whole host of guards and I don't know who else wrestled me to the ground and I kept trying to get free. My hands and feet were flailing around in the air like an octopus tentacles. Take her shoes, they said, they're weapons. And my well-worn, perfectly broken in, beloved cherry 1461 Doc Marten Oxfords were ripped from my feet. So that was the night that I learned what mental health care was all about, asking for help and instead getting and being harmed physically and emotionally. And as a result, for many years, as Craig was saying, I was unwilling to seek the care that I needed when I needed it most. And my cherry red Doc Martens were relegated to the back of my closet, collecting dust in their beloved cracks and crevices. They were the embodiment of the trauma of that first hospitalization. I couldn't bear to wear them. I couldn't even bear to look at them. They were a reminder of what was so broken about me and what was so Black about being Black in America, and that somehow that treatment that I received must have been deserved. But I couldn't let a broken system define me as broken. I couldn't let being Black and Indigenous in America define me as anything other than what I am, which quite frankly is an unapologetically Black unicorn. And Black unicorns are symbols of freedom, power, and strength. And I know I am not mystical, I'm not rare, but I am fierce. And I had seen other people living with this experience of psychosis be activists and speak out about their struggles to survive. However, I had not seen many Black folks and wondered, who's going to speak for us and light that recovery pathway? So perhaps my journey is that light and an example, especially for folks who look like me, and that I needed to learn how to tell my story for my own healing and the healing of others. And with support from my family, my peers, I started to think about something Maya Angelou said, which was the need for change bulldozed a road down the center of my mind. And I learned how to reconnect with the ferocity and tenacity that lay dormant under the guise of my mental illness. The fiercer that I became, the less the illness defined me. And I'm Karis, who has some voices on occasion, but I'm me, and I'm an audacious Black mental health advocate. So I just want to follow up by saying, in my work over the years and conversations that I've had on the podcast that I do, Unapologetically Black Unicorns, where I talk to people of color, people with lived experience, people who are doing things in this work, and I've had a few episodes specifically on 988, I'm realizing that in some ways, sadly, not much has changed. And 988 holds a promise to ensure that someone is there to call. It's a doorway into what may be what is next for folks with a need for more and in-person services. But what services will they receive? It's not only about how people will get there, but about the experience they will have during the transport. It's not only about where people will go, but the experience that they will have when they get there. And it's not about resolving the immediate crisis. It's also about the support that they and their loved ones will receive as they work towards recovery. It's also, yeah.
Sorry, Karis, didn't mean to
I
cut you
can't
off,
see.
but thank you. Thank
Yeah.
you for sharing your stories. Thank you for not letting the voices win. I'm so glad that you're here, and thank you for doing this even while you're not feeling well. And I think it is incumbent upon us all to ensure that we're not placing additional burden on individuals with living experience or attempt survivors, but really making sure that we are sharing that because we all have a role to play in this. And, you know, we can't just have folks telling their story over and over, but really what are we doing to ensure that we are incorporating the lessons learned? So thank you. I'm sorry, we do have to keep going, but I really appreciate you sharing this, Karis. And I highly encourage everyone to check out the Unapologetically Black Unicorn podcast. It is amazing and comes out weekly. And I think there's a link in the chat. So thank you. Let's go to the next segment. I want to turn it very quickly back over to Stephanie to give us a little preview of an conversation that we'll have in the future with Sarah Corcoran from the Guide Consulting Services.
Thanks, Laura. So this article actually ran last week. So it's already live. And it was a conversation with Sarah Corcoran, and she's the Vice President of Government Relations at Guide Consulting Services. And she shared that COVID was the tipping point in mental health and substance use legislation. She said today there's still a steep climb, but the incline is getting better. And I feel like what she said is what I've heard from a lot of leaders since COVID began in 2020 in the United States. And except that what's interesting is that it's happening and affecting legislators. And so what does that change, and what kind of push does that create within Congress? So it was a really interesting conversation. And I feel like it goes back to, you know, our conversation in the green room, Laura, where it was like the 411 on legislation and the congressional process. And I mean, some of this information I had no idea. So like, for example, I guess every Congress, there's roughly 10,000 bills that are introduced, and only around 300 to 500 pass. I mean, it shows you, and she had a funny quote about that where she said, you know, the odds are not in their favor. So it's a great piece to kind of give you that background information, but also to see that this is an issue, this crisis is affecting everyone. And what impact that's been positive is that it's pushed legislators to make substantial changes. And so I think that's an important dialogue to have.
Yeah, thank you, Stephanie. We are running out of time, so I'm going to keep us moving, but I do think that this is important. We're at the 2-year anniversary. The Designation Act was signed into law October 17th, 2020, which required the designation of 988 as the 3-digit number for the lifeline. And so in that 2-year span, there's been such a shift in the conversation, both federally and at the local level. With Congress being out, we're going to move forward through the federal section, and I'm going to turn it through. Oh, I'm sorry. Let me quickly go to Joanna from AFSP.
Hi, Laura. Yeah, I can go very quickly. I realize we're running out of time. I just wanted to flag the Senate Finance Committee came out with their workforce expansion draft last month, which included a lot of good provisions for Medicaid, Medicare coverage expansion, as well as supports for workforce and physicians and behavioral health workforce. So that was really good to see. We're still waiting on the parity draft. We don't know when that's coming. Laura had mentioned that the Congress is out of session at this point. They're all at home in their work districts for the home work periods. So they will be back November 16th, and we're hoping to see some action on appropriations as well as other mental health procedures, but we're sort of waiting to see what's going to happen there. They'll only be in session for 5 days before they go back home for Thanksgiving break. They did pass a CR to put off a government shutdown, which was passed in September 20, So yeah, end of September. And that included $62 million for the Lifeline. So that was also good to see. And we are sort of working back from the midterms. So as a little civic duty plug, don't forget to vote on November 8th. That can be it.
Yes, thank you. And so they're in the home districts. That means they are local to you. So feel free to reach out and let them know how important crisis services is to you. I'll go to Hannah from NAMI to give us a quick update on Reimagine Crisis.
Yeah, thanks, Laura. I'll be super brief. I'm going to drop a link as a reminder to our map with that ongoing tracking of state legislation and appropriations across the country. You know, I want to thank Craig and Karis for sharing their experiences and their stories today. As Karis said, 988 holds such promise, and that's what Reimagine Crisis is about. It's about holding policymakers accountable to realize the promise of 988 in a crisis response system and making sure the voices of everyone impacted are at the table. If you go to reimaginecrisis.org, there's a lot of resources there. Happy to talk about it with anyone offline, but I know we're at time. There's a lot of work to do in the year ahead, and just grateful for all the partners on this call.
Yes, and I'm going to apologize to everyone because I have mismanaged our time. So I'm going to skip us to the end. Of course, there's America's Soul on suicide. Please watch those episodes, really great. Of course, a new segment with Vic Armstrong, who's very dapper here and is going to talk to us about race and equity, because this is an ongoing conversation. And then as we look ahead, we've got some really great sessions coming up, including one opening the new year in January 4th with SAMHSA Youth Crisis Guidelines. But ahead of Thanksgiving, next week, we have the Native and Strong Line. Great work happening in Washington. Thank you all for spending the hour with me and with each other in this learning community. And look forward to seeing you all next week.